Treating chondral and osteochondral knee lesions remains a challenge. The current surgical standard of care includes debridement or microfracture, approaches that may relieve symptoms but do not fully address the underlying disease process. A novel solution is an Aragonite-based scaffold, derived from coral. It mimics the structure of cancellous bone and supports the body's own cells to regenerate the subchondral unit, with a single-stage procedure. In a multi-center randomized controlled trial across 8 countries, 251 patients were enrolled. 167 received the Aragonite-based scaffold, while 84 underwent either microfracture or debridement. At 5 years, follow-up rates remained high, 88.4% in the scaffold group and 83.1% in the standard of care group. The primary outcome, KOOS, improved from 41.2 to 81.0 in the scaffold group. This represents a 22.6-point greater improvement compared with standard of care, which reached 59.1. The overall KOOS responder rates were also notably higher in the scaffold group, 74.7% versus 29.6%. At 5 years, far fewer patients needed a knee replacement or osteotomy after the scaffold implantation, 1.8% versus 9.5% with microfracture or debridement. Secondary patient-reported outcomes significantly favored the scaffold group, including KOOS subscales and IKDC scores. Importantly, the scaffold group experienced fewer treatment-emergent adverse events and a substantially lower overall failure rate, 15% compared with 35.7%. A lower failure rate was also documented in patients with mild to moderate osteoarthritis, 13.2% for the scaffold versus 40.7% for the standard of care. In summary, at 5 years, the Aragonite-based scaffold demonstrated sustained superiority over microfracture and debridement, offering improved function, reduced failure rates, and a promising regenerative approach for treating chondral and osteochondral lesions of the knee.